time, we're going to talk about Donate Life Victoria customer success story for a bit. Let's take a look at the core team or representatives of the entire team that we have. I'm Talia, I'm the solution architect and also one of the members that's been in the core development team for this project. And we have great Melissa Brouwer here.
Thanks, Talia.
who was and still is our product owner. And then we have Tony Holland, who is the general manager for Donate Life Victoria. Welcome.
Thank you.
Thank you for joining today.
It's great to be here.
So Tony, can we start from scratch and can you tell us about Donate Life Victoria?
Sure. Donate Life Victoria is one of the state-based organisations that works in the hospital system to facilitate solid organ donations from deceased donors. So we work with families of people who are at end of life in the hospital system to determine if there's an interest or an opportunity to have their loved one become an organ donor. Two simple steps. While I've got the mic, register on the Australian Organ Donor Register, go to mygov or donatelife.gov.au and have a conversation with your family. Because if you do register and if you do have a conversation with your family, you're around 3 times more likely to be an organ donor than if you don't. So it's a really important step to take. So we have nurses and doctors who work across 22 public hospitals in Victoria in the ICU to determine if there is organ donation. Around 2% of Australians can be organ donors, so it's a pretty rare event. And our biggest year there was 193 organ donors. So that doesn't sound like a lot, that's from Victoria, but there's a lot of effort and energy goes into one organ donation. And it's a very complex and complicated process, as you can imagine. It's a massive logistical exercise. There can be jets going from one side of the country to the other, taxis, Ubers, all sorts of things, moving organs, coordinating surgeons and so on. It's a very complicated world. And so yeah, it's a great privilege to be part of such an exciting and life-saving work.
We truly appreciate what you guys are doing. Thank you so much for doing that. Okay, so the reason that we're here today is to talk about the Salesforce implementation that we recently completed. So what we delivered in a nutshell is a project that helps day-to-day operations of Donate Life Victoria team here. And we delivered it using agile methodology, end-to-end, utilizing Salesforce, CRM, and Experience Cloud solutions. Before we get into that, Melissa, let's talk about what the life was like before Salesforce. Spreadsheets,
all of that, yeah, very manual. And also, just on what Tony was saying, all of our staff are out in the hospitals doing life-saving work, so we wanted to sort of take some of that burden away from those operational matters. So we wanted to build a CRM that would sort of help and ease up some of their work as well. So originally, in the past, we were working on spreadsheets, as we all do, very heavily reliant on people. So unfortunately, when people were to leave the organisation, we kind of felt we were scrambling to find any of the processes that were in place. So I keep trying to skip to the now because we're so used to it and I'm so excited that things have changed. But yeah, definitely spreadsheets is one of them. A lot of the automation process, so again, was reliant on people, but we couldn't get the information we wanted timely either. So originally we were wanting data, or we were getting data from our Organ and Tissue Authority up in Canberra. We would get this on a quarterly basis, but we could never share this information timely with our hospital staff and the executive within those hospitals because we would wait until annual meetings to share this information. So now, again, we've created this amazing community portal where hospital teams can access this information more timely via the portal. So that's really exciting. Again, I'll talk some more about that when we go to the now, but yeah, so it's definitely changed, but it was
great to hear that. Love to hear that over and over again. Just never stop saying that. It really feels good. Tony, how did you decide to elevate the operations? What was the decision-making process there, selecting Salesforce?
Slowly and carefully, I think is the key things I'd say. you don't rush this. You've got to be really clear about what you want and how you want to achieve it, and know where you want to end up. Because if you don't do that properly, it'll be a mess. It'll be a mess. So we started 2.5 years ago, talking to our team. We had clinical representatives. We had a doctor and nurses, senior nurses, comms, marketing people, and obviously admin and operational people in the room. And we looked at mapping out some of the basic requirements of what we wanted and looking at what solutions were out there. So we just didn't look at Salesforce, we looked at a range of other solutions as well. I'd had some experience in my previous role with Salesforce, and probably took us a few months to actually determine that Salesforce was the platform that we wanted, mainly because of its size and flexibility. We're a not-for-profit, but we don't do any fundraising. We don't raise any money at all. We are fully government funded, as you can imagine. We're a health service, so we're not allowed to do fundraising. So, even the term Salesforce was a bit odd for our team. They said, why are we using a sales system, right? But anyway, we got over that relatively quickly, and then we identified how we would make it work, because Salesforce, whilst it's very adaptable, it's quite complicated. And in its simplest form, it's pretty easy. But when you start looking at automations, you need people who are going to help you to get it right, to set it up right. And I always use the analogy of building a house. If you're 3/4 of the way through the build and you want to start adding doors and windows, it gets very, very expensive. So it's always better to spend a lot of time thinking about the planning process, going over and over and over the plans. As we're building Salesforce, I've been building a house as well. So it's the same thing. The same principle, going over and over and over and rechecking. And so we then looked at who would be our partner, and we spoke to 2 companies, and in the end we decided that SalesFix was definitely the right partner for us, because we're part of Lifeblood, the Red Cross blood service, and even though we're sort of a separate unit we don't do anything with blood. We're only organ donation, but SalesFix had worked with Lifeblood before, so there was a pragmatic sense that it was easier to actually not have to set up a new supplier and go through all of that stuff that they have to do, those terrible rules that they have to comply with to get a new contractor on board. But that wasn't the main reason. The main reason we believed that they could do the job, and that's in fact been the case.
Right. Melissa, I believe you volunteered to be a product manager, right? And it was there all along.
Just get in there. Yeah, it was a pandemic happened, so nothing else to do.
How would you describe the delivery process as the product manager?
Yeah, so look, a lot of people were involved, but we had a lot of skilled professionals in Lifeblood that we really utilised. So we had a project manager on board, we had data analysts, we had IT professionals, myself, and a lot of subject matter experts on board as well. And we did, as you mentioned, using the agile model, we phased our live, so we went out sort of over a period of time. So we didn't just throw everything at our staff. We released every sprint. We had how many sprints? Or we had lots of sprints and 5 phases, and we just released slowly throughout the year, because we knew a lot of people had, we were going through, unprecedented situation. Our staff were out in hospitals, all being diverted to the ICUs to help with the pandemic. We couldn't really have access to them, so we really had to phase our approach out. So we had to do a lot of change management, ease them into using Salesforce, but we're all nearly there.
Yes, we are. So through this implementation, what we did was bring internal users and external partners together, and we achieved, I believe, the transparency, visibility of several KPIs and data. And so, what do you think? What have we achieved specifically from this implementation?
We've achieved a lot, and again, when we started this project, we didn't realise how big it was and how big it got, and it still continues to grow, which is fantastic. But what we've got now is we've got processes in place that we never had before. We've got, you know, a system that everyone accesses every day to get the information that they need at their fingertips, which has been great. You know, one thing with Salesforce, which we realise and we continue to do, is do enhancements. So when our staff are using it, we can then sort of tinker it in the back end if they find that they haven't got exactly what they want. Or we can show them how to do things a little bit differently within Salesforce. We can easily do those little manipulations on the move, which has been fantastic.
Perfect.
In fact, yesterday is a good example of this, and I'm one of the worst offenders where I rely on what I've known. And we've been working with the 7 major public hospitals for a big project over the last 2.5 years. And I have a standard distribution list. And what I did is copy and paste from the last email I sent a few months ago and put it into a new email. I got an email back from one of them saying, "Tony, I told you that this person had list. Can you please update your list?" Oh no. So immediately I ring Mel and say, "Okay, Mel, I've got to sort myself out here." So we went in, made a few tweaks, created a report, and now I will use, as I should have always used, the source data from Salesforce rather than rely on another data point. And I've sent that list out to my senior nursing managers to say, please check the list to make sure it's current and accurate. And I should have been doing it all along. So it's just a classic example of how, you know, you need to use the system that's the source of the truth.
And do you feel like we're on track with the initial business case that you had in mind? Are we going towards the right direction? What's the next steps? What do you think?
Yeah, absolutely. One of the biggest, as Mel said, we started with a particular view in mind, and we've definitely changed a number of times during the process to adapt. You know, I always think of the concept of VUCA, volatility, uncertainty, complexity, and ambiguity. That's the world in which we live, and you have to be able to respond. And I believe that Salesforce can help you do that. So when we started, we had all these dreams about what we wanted to do. But what we've actually come to now is we see that Salesforce is one of our core platforms, part of our core platform. And our platform includes SharePoint, Teams, and Salesforce. That's our IT platform. And we don't want Salesforce to do things that Teams or SharePoint does. So that was a big revelation to us. So we're really focused in on what does Salesforce need to do rather than, you know, it's not a document server, you know, that's SharePoint. It's not a communication tool, that's Teams. It's not a collaboration tool, that's Teams. Even though there's open source information in SharePoint, in Salesforce, it's not the primary collaboration tool. We use Teams for that. So that was a big revelation partway through. And another revelation that just hit me out of the blue, and this is probably the greatest joy of my life, is we have a very close relationship with particularly the 7 major hospitals in Melbourne, but also all of the other public hospitals. And managing relationship with them and managing information flow is critically important to us. As of through X time, our nurses will be moving to full employment with the hospitals. So even though we manage their work, they will be employed by the hospitals. So our nurses work at their base hospital, so they might be based at the Alfred, but there might be a case at Bendigo. So they go from the Alfred to Bendigo to manage the case. And so we direct that. They're on a roster and we direct them to say, okay, this case on, you got to go to Bendigo. But they actually don't work for us. So there's got to be transparency between ourselves and the line managers. So we've developed a thing called time logs, where the nurses on their app can go in and enter the time they leave their hospital, the time where they're going, and the time they leave that hospital to come back to the hospital or go home. So it's a time log, shows transparently what they're doing. We also have within that same area an overtime log. So when their overtime is approved by their line manager, by us, they have to put their overtime in the app, and it goes into Salesforce. We're using the Salesforce Community portal, which was the most exciting. I never heard of the Community portal until about 6 months ago, and I nearly fell over because this has solved all of my problems in one foul swoop. Because we now have a close to real-time engagement tool to use with all of the hospitals that we work with. They can see the live roster, they can see the current on-call roster, they can see the time logs, but just for their hospital. So the portal can actually, we can set it up so that only St Vincent sees staff who have been out of or into their hospital, not what's going on in another hospital, and only see their staff's overtime report. And just to see what I mean, it's very flexible. We're also using it as a communication tool to give them updates on organ donation news and so on. So using that community portal has been earth-shatteringly important for us, and it's changed the world. So we didn't even dream of using Salesforce for that when we started 2.5 years ago, but now it's probably one of the most important parts of it. And it's not quite ready to go, it's close. We're just getting the logins out to the hospitals, and we'll obviously look for their feedback, but that's a good example of how we're continuing to build, and that's the major point of enhancement right at the moment, but there's lots more to come.
Absolutely. How about the enhancements that we're talking about? How are we making sure that we're prioritizing the enhancements and making sure that we're again going towards that set goal that we have?
So that's probably my role in this, is to prioritise what enhancements need to be completed. I have Tony, who wants everything now, and I'm sure he wants all of his staff also want things to be changed to suit them. So I need to gather that information and prioritise what's necessary. Because we spent a lot of time building a platform built on what people originally wanted. So we need to be able to train them and make sure they're using it in the way that they requested it originally. And we can make those slight tweaks to make it, fantastic, amazing. But to recreate, you need to prioritise that. And some things need to be sort of left a little bit until they sort of really start using it and understanding the system. You can't keep creating new things. So there is a lot of managing from my end just to kind of ease people into it and back off a little bit sometimes because everyone wants everything now. But we have a great system, Talia. We work with teams on Talia with all of our work plans. We also work on Azure DevOps, which allows us to create backlog items, to approve them, and everyone can work on the same information. So nothing is getting lost or nothing's getting left behind as such. So all of the feedback that we get gets logged. We talk about it in our weekly chats, in our weekly meetings, and then just prioritise as we move along. But everything needs to be logged, everything gets reviewed, and we do a fair bit of enhancing.
Yeah. We do. One of the really important things that we've done is we have weekly catch-ups, drop-in sessions, we've picked up a lot of information from those drop-in sessions, and Mel can then use that to build the plan, the plan going forward. And I just wanted to give you 2 examples of some really simple things that we've done that we need to now tweak because we've realised that that we need some slight enhancements in it. One is a thing we've called our employee engagement process. Lifeblood requires us to have quarterly engagement conversations with all of our staff. And that sounds quite simple, but to track that across 35 people with about 5 different managers, and for me to be sure that everyone's doing it on time, every time, is quite complicated, to be honest. So we wanted to build a system that was really simple and easy. So we've now got a workflow, an automatic workflow, that when somebody starts, it automatically creates a first meeting, which is at 6 weeks. That's the probationary 6-week meeting. When you complete that meeting, it automatically creates a 12-week meeting. When you complete that meeting, it automatically goes into the next quarterly conversation, and that keeps rolling like that. So every time you complete a conversation, it automatically creates the next meeting date. And I have a dashboard report that's on my homepage that shows me managers who've got outstanding performance conversations, and I can check to see what's going on. What we've found is that already people are starting to use that for other conversations with their staff, just an occasional catch-up, which is fantastic. But when you complete that conversation, it automatically rolls to the next quarterly. So we need to make a tweak so that it doesn't change that quarterly roll, it just creates another meeting. We have another little widget for hospital engagement, and the same thing. We have annual executive meetings with our hospitals, and we also have monthly line manager catch up between our senior nurses and the line managers in the hospital. Again, a monthly roll. They have the monthly meeting and it rolls to the next. But when the annual meeting was put in, it automatically created the roll to the next monthly meeting. So we've got to do some tweaks in there because people are using it. They're using it for ad hoc because we want it to be transparent. You know, that's one of the benefits of Salesforce. We want people to be able to see what's going on, see the conversations. Obviously, the performance conversations with the staff are private. They're in a secret area just for for the manager and above. But that's another good example of how people are really starting to use it on a proactive basis, and it's had some unintended consequences which we now need to review. I want it done today, and Mel says, "Hold on, Tony, it'll be done as soon as we get it done." But but we want people to use it. We want them to keep stretching and keep pushing to actually be able to use those little, and they're all little tiny bits and pieces. But it's the whole package that actually makes it worthwhile.
That is so exciting, isn't it, what we're trying to do? So this is a system that evolves in time, right? We set something up, and people start using it, and then they need more. They need different things. They need additional items there. And it's lovely. It's so exciting.
It is.
Thank you so much. Do we have any questions? Sure.
Yeah, just directed at Melissa. I guess I come from a charity where it's small, we've got 12 part-time employees. So I guess did you have to go and do some training to be champion within your organisation?
Yeah, I did do Salesforce admin training earlier on in the piece, which sort of helped me with the terminology that Salesforce uses, kind of understand a bit of the back end. I think Nicole asked me the other day if I would recommend doing it, and I said absolutely yes, but I'm not sure if doing it before you engage in your build, if it's better to do it before that or sort of halfway during the build, so it all sinks in. That was my personal training, so that's what I did. With Talia as well, just speaking to her, she really guided me, and we would have sessions along the way as well to sort of understand, how to build some of these things that we did and some of these tweaks that we need to make along the way. So she was incredibly supportive, as well as Sushant as well. Even Mary was great too. So all the team at SalesFix really helped and supported me along my journey, definitely.
Yeah.
I was just going to ask, thank you for sharing your story from nightlife, but especially with all of with COVID and hospitals being so overwhelmed with the work that they're doing, I was curious if you've heard any feedback about the portal you created, because I mean the internal team is excited, but have you heard much from the hospitals that are engaging with that and working with you?
It's just starting, but we've transitioned our staff. We had this really odd thing called dual employment. So our nurses were employed partly by the hospital and partly by Donut Life. It was weird. And we're now moving with effect the 1st of April, they'll be solely employed by the hospitals. So we've spent 2 years working on the transition plan, and we've developed a thing called the division of responsibilities, which is like how we play in the sandpit together. And part of that puts a lot of responsibility on us to be transparent to the hospitals. They've pushed very hard that they're the employer, but you got to tell us everything you're doing. And so it was really a necessity, to be honest. We've shown them, and they're certainly very happy with what they've seen so far. But we're really excited to go to the next step and actually have them using it and seeing what they think of it. So, for example, one of the things that's come out already from our interactions with them is they wanted an automatic process of knowing that their overtime had been approved. We approve the overtime, they pay the overtime. So it's complicated, right? So we built a little tick box in the time logs so that our line manager could go in and tick the box and put their name against the box to say that they'd approved the overtime. So when the line manager in the hospital picks it up in the community portal, they'll see that the overtime has been approved. They don't have to check it. So that was a direct result of the engagement we had with the line managers in the hospitals. So we're very excited about where this will go.
With like a lot of technology investment, it's usually the initial investment is quite steep. I was just wondering, back in 2.5 years ago, how did you sort of justify this investment to the sort of business stakeholders? Because obviously, sort of running the spreadsheets, the business is probably operating relatively efficiently. Often, when people sort of see that initial sticker shock, they're kind of like, is this really worth it? I'm just interested in that sort of approval process, how that works.
Sure. I started in August 2020. 19. And I walked into an office, really nice part of the city, but I walked into a very tired office. Very tired, grungy carpet, shitty paintwork. And I thought, we do really serious work. Our staff deal with death and dying every single day, and this is a really shitty place. And I thought, we've got to do something about this. So the first thing we did was our funding comes from the Department of Health. So I put a proposal and said, we need to do something with this office, it's terrible. And so they approved immediately, just off bang, and we did the office up. Within a month or so, and lots of conversations with Mel, there are lots of boxes. What's that box? Oh, that's workplace health and safety. Oh, what's that box? Oh, that's our plan for how we're going to manage events. Okay, righto. So who does that? Oh, no, that used to be done by Mary, but she left now, so Fred's doing it now. And I thought, okay, righto. So I said, what are our systems? How do we manage the business? Because Donut Life is all about the clinical work, and they do that really, really well. And they have very, very strong guidelines and principles they have to follow. But the business itself has suffered over many years of sort of not really having anyone. There's never been a general manager before. The leaders of the organisation have always been clinical people, and so the business side had never been nurtured. So it actually wasn't that hard, to be honest. I put the case to them, and it was a significant amount of money. As well as the office renovation, we put in 2 brand new audio-visual suites in our office because we do a lot of web conferencing, a lot more now than we used to. And so I put a very simple case to the department, and they approved it immediately because they could see that things needed to improve. There are a range of things that weren't happening that should have been happening. For example, we now have a dashboard reporting process that we use with the Department of Health that we never had before. We automate that from Salesforce. Number of performance appraisals, number of hospital visits, blah, 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 blah. All automatic and simple now. So it was pretty easy. The need was there. They could see the need and they approved it. I'm not saying it would be easy in your environment, but in ours. I'm glad I'm not doing it today though, because obviously the health dollar is much, much slimmer than what it was 2.5 years ago.
Thank you.
Well, thank you.